this is Jocelyn Poblati from BSN2B. So for today's video, I will be showing with you how to properly done the Leopold's maneuver as well as measuring the funding height of a pregnant woman. So without other further ado, let's get started. Good afternoon, ma'am. I am Jocelyn Poblati, your student nurse from Biliran Province State University. So for verification, ma'am, may I ask your name and your birthday?
My name is Joanna Alva Vieira. My birthday is January 9, 1998.
Okay, ma'am, how would you like me to address you?
So you can call me Joanna.
Okay, Ma'am Jana, allow me to explain the procedure that we will be doing today. So our procedure is called the Leopold'S maneuver. It means it has 4 maneuver or 4 grips. This is important for us to know the fetal presentation and fetal lie of the baby inside your womb. So is that okay with you, ma'am?
Okay.
So we start our assessment. You can first urinate in our restroom so that there will be no discomfort once we start our assessment.
Okay.
For the next one, do the proper hand washing to avoid any cross-contamination of microorganisms. Allow the pregnant woman to lie in a supine position with slightly knee flex and provide a small pillow and put it on her back so that it will not cause any supine hypotension syndrome.
Ma'am, allow me to remove this one and expose your belly.
Okay.
So for the first maneuver or fundal grip, we will be assessing for the presentation of the baby or the fetal lie. So we're going to be assessing if it's breech or if it's cephalic. You can see if it's breech, if it's round, if it's hard, and if it's movable. But if it's round, soft, and immovable, it means it's cephalic. So I will be facing the client and I will be forming a triangle. So you're gonna palpate right here and observe for the necessary findings that I said you earlier. So now I'll be using my tape measure to identify the funding height measurement of the baby. I will be using the centimeters part. So the zero line must be superior to the symphysis pubis, which is located right here. So we're gonna be following the abdominal curve. So remember that it must be the abdominal hand. So for the next maneuver, which is the umbilical grip, we're gonna be palpating on the sides of the uterus. Now in here, we're gonna be determining the fetal's back because it is important for us to know where can we auscultate the fetal heartbeat. So the fetal's heart rate is important because we will be placing the Doppler here later on our fetoscope to determine the normal heart rate of the baby, which is 120 to 160. Now, I will be palpating right here. So observe that my left hand will be stationary for a while my right hand is moving. So palpate it from top to bottom and vice versa. So my right hand will be stationary for this time and my left hand will be moving again from top to bottom. So you can determine the fetal back because it is flat and has a resistant surface and it is hard, but if you palpate any angular nodulation, it means that it is the lower extremities of the fetus or it is the elbows and knees. So now let's proceed to the third maneuver, which is the Pollux grip. So in here, I will be forming an L shape on my hand, which is the thumb or the index finger. So I will be placing it right above the symphysis pubis of the patient. I will be putting it so we're going to be observing here the degree of engagement. So if this moves, when you move it from side to side or when you move it upward to lift up the head, because some other institutions do that, it means that fetus head is not engaged. But if you move it and immovable, it means that is engaged. So, and for the last maneuver, we're gonna be doing the pelvic grip. So this is the fourth maneuver. So for the first, second, and third, we are facing the client. But for the fourth maneuver, we're gonna facing his foot. So we're gonna be starting here. We're gonna have approximately 2 inches, okay, and the inguinal ligament. So we're gonna be palpating it in motion. So through the sides again. So this is also somehow to confirm the second maneuver, which is the umbilical. So in here, we're gonna assessing the degree of afflection. So we're going to be palpating it. So remember that a well-flexed head is right opposite to the fetal back. Once you've done with your assessment, make sure that your patient is in a comfortable position. So don't forget also to wash your hands and note all unusual findings or any findings that you have found on your patient.